We've never stopped being open at Tri-City. Thanks to our stellar facilities team and our program support teams, Tri-City was able to quickly secure ample personal protective equipment, disinfecting supplies, and things like that. Our facility staff are every day in all of our sites, cleaning on a regular schedule throughout the day, making sure that staff and clients who have to come into the clinic for services or to our other locations are themselves safe. We have necessary precautions at every front door. Temperatures are taken, people are offered PPE. We have PPE to give to persons who have to access our site and don't have any of their own. So we are open during our regular business hours, Monday through Friday, 8:30 to 5, and the Wellness Center, which is usually open a little later, is now on that same schedule. And you'll hear more about the Wellness Center from our MHSA director a little later on. You know, it's been 9 months, and we at Tri-City have done lots of community webinars, lots of informational webinars on different topics related to COVID, social unrest, the racial discrimination and disparities, working with different vulnerable populations and how they're being disproportionately impacted during this time. But we really hadn't set up a time to talk to you about the agency as a whole and how we're doing. And I think it's extremely relevant now as we are in the midst of a new surge. Things are starting to shut down a little bit here and there again. We're in the holiday season. And in the last few weeks, there's been clear research coming out to show that, one, persons who have a mental health diagnosis, in particular persons who've been diagnosed and have been receiving mental health care in the past year, are actually contracting COVID at higher rates than the typical population than you would expect. So they're actually listed now as a vulnerable subpopulation in COVID-19 pandemic and response. Second of all, a recent study came out 2 weeks ago that shows that 1 in 5, 20% of persons who have been infected and suffered through a COVID illness since the pandemic began are developing diagnosable mental health symptoms within 90 days of ending their sickness. And we're talking depression, anxiety, and some folks post-traumatic stress disorder, depending on the severity of the condition. So mental illness, mental health support, and COVID go hand in hand, and as do the other issues that are affecting our communities and our countries in the past 9 months. In addition to being open, and you're going to hear about all of our services from the executive team, I just want to share with you a little bit about what Tri-City's been doing community-wide. We've been actively partnering with the City of Pomona, City of Claremont, our local police departments, and other community organizations to not only get the word out about how to stop the spread of COVID, to partner in ways to make sure that there's access for all of those who are in need of services at Tri-City, but also working with our partners to make sure that we know about all the resources, including food and basic needs, and even community PPE that are available, housing options to those in our 3 cities. We're proud to be the host of a community PPE and disinfectant drive at each one of our locations at Tri-City. There's a box out front, and for anyone who would like to donate PPE, we're talking masks, gloves, and cleaners, disinfectants, hand sanitizers. We've even heard of requests in the community from some folks from parents who are ill that are asking for paper plates and cutlery because they don't want to be using dishes and cooking while they themselves are trying to stop the spread within their families. We know that PPE and disinfectant come out of food and rent budgets, and there's not a lot of extra money. Our community has been hit hard by unemployment and lack of financial resources at this time. And so not only can you donate, but you can also access community PPE by reaching out to our community navigators. And so you'll be seeing a central number for Tri-City in this presentation, and encourage you to call that if you have any needs or you'd like to donate. And then finally, I just want to share with you that, you know, COVID has not been the only trauma that we all have been through. Many have really significantly been impacted by the social unrest, by the murders of Breonna Taylor and George Floyd and others in this difficult 9 months. And the issue of racial equity and eliminating disparity in access to healthcare, mental health, and all aspects of our community is also in the forefront of Tri-City's mission and heart. And so we have recently started working with a consultant who is working with all of our staff to ensure that we ourselves are doing our best and working towards really walking the walk of being an anti-racist organization, and making sure that everyone who comes to our doors or who calls us on the phone or who joins a Zoom meeting with us feels welcome and included and accepted, and that a concern about a racial inequity is not something, not a barrier that people will find at Tri-City. So again, we're here to serve you, and I'm going to pass it along now to the rest of my executive team. Thank you again for spending an hour with us tonight, and we hope that when you need us, you call us. And this will be recorded, so you can also share with friends and neighbors in the future. All right, so the first up tonight is Diana Acosta. She is our Chief Financial Officer and has been with Tri-City for 6 years. Diana.
Good evening, everyone. As Tony said, I've been with Tri-City for 6 years, and I'm sure you must all think that I have to say that this is the most challenging year by far, but it's mainly, you know, just about getting used to the new normal, managing online calendars and, you know, just managing the new normal. So my department has a staff of 8. And our job is to make sure that, you know, Tri-City, you know, pays our bills, pays our employees, make sure that we're, you know, all the resources are available to serve the community, and, you know, continue meeting the needs of those who are in need. You know, one of the most, like I said, one of the most challenging things is getting used to the new normal. And I have to say that the most, you know, one of the things that's come out of it is it's made us more efficient. We do things differently with respect to managing things online electronically, something that we'd wanted to do even before COVID. So that's one of the positive things that it has come out of COVID, is helping us move into the new future, right? The new way of doing things. But I just wanted to, you know, let you all know that Tri-City's in really good shape. We've actively been working with obtaining grants so that we can continue to provide the services that are needed. And concerns for us have been always the finances, but I just wanted to say that, you know, we're in really good shape and we've got excellent reserves, and we're just continuing to keep an eye on what's going on. Not only in the community, but statewide, and we're here. We've been here since the very beginning. All of our staff rotate so that we ensure that we've got, you know, the proper spacing, but we're here 5 days a week, and we're happy to serve. Thank you.
Thank you, Diana. Next up, we have our Chief Clinical Officer, Angela Grisson. And Angela's been with the agency for 2 years.
Hi, everybody. It's great to be here, Facebook Live. How techno is that, right? Well, that's absolutely one of the things that our department had to learn how to do. We all had to learn how to use technology in a way we never thought we would, at least not so quickly. I mean, in public mental health, this kind of a switch is something that usually takes, you know, 5 or 10 years. And at the beginning of the pandemic, what we learned was that we had to move things along very, very quickly. Our teams and my teams are, you know, made up of therapists and clinical wellness advocates, and our team had to switch from mostly, in-office settings. We did do a lot of community work, of course, too. But now we, in the span of maybe 2 weeks, had to figure out like how to keep everybody safe. That was our primary concern, and that took some effort to figure that out. So we wanted to keep the doors open, of course, and we did. And we wanted to make sure we provided the opportunity for people to come both in the clinic if they needed to or wanted to, and also the ability for people to stay home if they wanted to receive their therapy via phone or via video. So what that meant for us, of course, is just the, garnering the protective equipment that Tony was talking about. So we had our masks so that we could rotate people in and out of the clinics, but we also had to figure out, okay, does everybody have laptops? Does everybody have phones? These are all things that we wouldn't have necessarily done for every single employee in the clinical department, but switching to the possibility of 100% online, we had to do that. And then we had to do that for our clients as well, right? I mean, so many of the folks that we work with, didn't have phones or didn't have internet. So we scurried around and we worked with Jessica on that, and we helped people get phones, and we had a stash of phones for our clients that came in because we wanted to make sure that clients had access to us when they needed it. And plus, when you think about everything that went online, and our clients, they needed these phones. So oddly enough, some of these like Maslow, I'm sure many people are familiar with that hierarchy of needs where you have to get the housing, you have to get the food. We had to make sure all that happened first, and the phone was part of it. And then once we got everybody set up, then we had to figure out, okay, well, how do you do therapy online? What does that even mean? Or is there anything different about it? And what we found that there were some things. I mean, I've heard folks say, Zoom fatigue is a real thing, and we found that was the case for a lot of our clients. At first, it was super fun, especially for our kids. I mean, the children that we saw and we treated, they were really excited to show off their rooms and to see their therapist and, just do this fun new thing. But after a while, it became one of those things that was kind of fatiguing, and we had to roll with our clients. If they could only tolerate a half hour, they only tolerate a half hour. The other thing that we found is, especially on the adult side, the preference is really still a phone versus a video. It was hard. It's hard for our adult clients to find privacy, or just the whole online internet thing was hard to navigate. So that was a little bit of a surprise. The preference was phone. We still have people coming in, of course, but people by and large really liked the phone therapy that we provided. So one of the happy surprises that we had from COVID is, again, what Diana was referencing, is we found that, especially for our intake process, everything is more efficient. We're able to get more people in for intakes and much faster. So that is something that we're going to keep post-COVID. That we want to be able to continue this efficiency. We also want to be able to continue with this flexibility that we've set up with our community around this. So as a result, what we found is our service requests in the month of October of this year, 2020, were 8% more than our service requests in the month of October 2019. So we're really excited because we've done the switch. We're able to get people in. We found it to be more efficient, and people are finding their way to us. So I'm really happy about that. The other thing to note is some of our programs were harder to switch over to a video format, like our therapeutic community garden. That one was more difficult because it's a gardening program. But what we did in this case is the folks on our team went out and bought the gardening equipment, maybe some soil and pots, and brought them out and dropped them off at people's individual residences. And then we conducted the sessions online. So we've been able to continue with our training. We had I see Dr. Burke is on the line here. We had a very, very large training effort for early psychosis intervention and identification. And so the teams were able to continue with all of this virtually. So, you know, we just kept plugging at it and kept moving forward in the best way that we could. And we were able to, you know, to accomplish things. So I think that's kind of probably my 5 minutes. So thank you, everyone.
Thank you, Angela. All right, next up we have Dr. Tiamori. Dr. Tiamori is our medical director, and he's actually been with Tri-City for 7 years. He's been our medical director for just the last 4 years. All right, Dr. T.
Thank you so much. Hello, everybody. Thank you so much for your time. So I'm the medical director. I'm a psychiatrist and a primary care doctor, and also I have privilege to work with another 6 other psychiatrists that we have on board, nursing staff, and also in our outreach team we have clinicians and case managers basically. So from the start of the pandemic, what I have been doing is informing everybody about the most recent data that we had, and also guideline from the CDC, and coordinating it with the human resources and also our executive team. So we made sure we have all the precautions in terms of staff have all the information, facility also has all the information, and we try to do the social distancing and make sure everybody has PPE, and everybody that comes to clinic gets checked in terms of temperature. So all the necessary precautions that can be done. Also, we have been working with our doctors. What we have been doing is basically having a balance between how much we want to expose people to come to the clinic, and as you know, the face-to-face, there is a risk with it, but at the same time making sure our clients have opportunity to see their doctor. So the initial visits have been done face-to-face when it's clinically appropriate, and if the patient was in high risk, and if the patient was willing to do it. And the follow-ups has been done through phones, and also a combination of phones and video conferencing, which has been doing good. And also of medical patient support team, we have been doing face-to-face visits and also providing in the field visits in cases that it has been necessary with all the precautions, and also people that we deem that they are okay to come to clinic to do the in-house medication support services. They have been doing that, and also the other team that I'm supervising is the outreach team. They have been doing excellent job in terms of continuing with what they have been doing, because their services has to be face-to-face, and make sure that the community knows that we are there and we are there to support them. But at the same time, we made sure everybody has all the necessary gears that they need to, and the precautions that is necessary for the safety of the community and safety of the staff. Also, I want to share with you our team about one of the services that we do is basically after hours supplemental crisis team, or basically after hours support. I want to share with you the screen that I have. Chris, can you please share the slide I sent you? Or if you can let me to share this information about.
And I'm going to hand you host real quick.
Oh, sure. So this is basically the information, the banners that we put in all of our buildings to make sure everybody can see it. And it's basically telling everybody that we are there, we can support, even if they want to call and just talk to somebody, if they have any concern.
We are still seeing you. We're not seeing your screen yet.
Okay, now. Okay.
There you go.
Okay. So it's basically the information with the number, and please share that with the community and whoever that you think it's necessary to have this information. It's basically telling the community by posting those banners in our buildings that we are there and we are here to support, and just give us a call, and we are more than happy to support. This is basically after hours, and we have been helping the community even people from outside of our Tri-City, basically, they have been calling and we have been helping them. Thank you so much, everybody.
Thank you, Dr. T. And
Thank you.
I think we'll show this slide again, and it will be on our website as well. So again, 24/7, we are here. This same number, even though this is, we're talking about after hours support, this is an 866 number that can be reached anytime. And when we're open, the front desk will pick up. So thanks, Dr. T.
Thank you.
All right. Okay. So next up, we have Remy Hundal. She is our MHSA and Ethnic Services Director at Tri-City. And she's been overseeing all of our MHSA programs from their start. Remy's been with the agency nearly 12.5 years. And Remy, take it away.
Good evening, everybody, and thank you for the introduction, Tony. Same thing as my colleagues have shared. We had to do go virtual overnight, and it seemed seamless. Our staff were ready for that change, and so we didn't have too many hiccups. But then COVID did come with its own challenges. In our PEI programs, it's always better for us to connect one-on-one in person, and the community navigators have always attended in-person meetings, so we weren't able to attend those meetings, but we still continue to do those over online. And community navigators still have a presence in the community with the proper equipment, proper PPE gear, and with proper social distancing guidelines. We're always following the social distancing guidelines, even when we are meeting with community members. And as COVID, really the numbers started rising, we had a local isolation center that was placed at the Sheraton in Pomona. And we were asked to be a part of the team over there, and navigators quickly went. We are still going there. We will continue to go there as long as the need is there. We are helping with discharge planning. We're helping with engaging clients. And it's not easy to be isolated, right? To be away from your family, and that fear that comes with COVID. What's going to happen to me? What's going to happen to my family members that are left at home? They couldn't come here with me, especially when parents have minor children. So the community navigators are making those calls to them, doing the check-ins with them, and asking them, how are you? Just to even say hi, for them to hear a friendly voice and a caring voice. So we've been doing that. And then also making referrals to the other clinical programs when needed. And so with COVID also came the opportunity for staff to think outside the box, right? So that was one of the positives that came out of COVID. We've always done trainings for the community. We've always been a part of the community, and we are continuing to do that through online trainings. We quickly changed to doing online trainings every Tuesday and doing a community connection every Thursday. And now, as one of my colleagues mentioned, that Zoom fatigue is real. And we're getting that feedback from our community members, like, yeah, I've been on too many Zoom meetings today and I can't attend your meeting. So now we're doing once a month. We're doing a training once a month, and we are doing a community connection once a month. And the community connections are about, for community members to come online on a common platform and have a safe space to talk about issues that are happening. What is it that's impacting them in their daily lives today? So those are continuing, and all of that, the trainings, and as long as we have permission from the participants from the community connections to share on the website, all of these can be found on the website under community programming, mental health trainings. All of our trainings have been uploaded over there. And if you would like a training that you think that somebody might need, please let us know and we will make that happen for you. And we're still engaging with our community partners like we were before, but everything's happening online. As Tony mentioned, the Wellness Center used to be open from 10 in the morning until 8 p.m. We had to change those hours because people when COVID first started, people were not coming to the Wellness Center, and we switched everything to do it virtually and to coincide with the clinic. The clinic was closing at 5 p.m. So we also at the Wellness Center closed at 5 p.m. Over the last few months, we are now offering over 30 support groups per week through an online platform. So what happens is, as Angela mentioned, not everybody had internet access. And this was hard for people to connect, and we didn't want to leave anybody out. So we have been giving them phone numbers, the 888 number or the toll-free number, to connect with us, to please still join the support groups and not feel like we don't want to hear from you. Wellness Center doors are still open. We are averaging about 2 to 3 people a day that are coming in to use the computer lab to stay connected with their loved ones, using emails, checking emails, using Facebook. That's the best way to stay connected, as we are tonight, right? So to be able to connect with their loved ones and to check in with people that are out of town and to see how everybody's doing. Our employment services are still, we are going into the office. We're just taking turns. Not everybody's there at the same time. We are helping 5 to 6 individuals per day at the through the employment services. And again, the computer lab is open. And again, even at the Wellness Center, we are making sure to follow the socially distancing guidelines and making sure the clients, the participants that walk in are safe, and so are our staff, that we have Lysol wipes in the rooms, we have hand sanitizers everywhere. If somebody does not have a mask, we do give them our masks, like, please take this just to be safe, and if you need to take one with you in the community, please feel free to do that. And as COVID happened, another positive thing that started was that the stigma that comes with seeking mental health services started to reduce when people started to, staying at home. With that came, as people were trying to navigate the new normal, certain feelings of mental health issues such as anxiety, depression, sadness have been a part of people's everyday life now. And so we have our peer mentors. This year we have, even during COVID times, we have 30 peer mentors, 28 to 30, depending on, the month. And we are able to offer services in 8 languages, and not only just Spanish and English, but some API languages as well, that's Asian Pacific Islander languages, to be able to connect with people. And these are individuals who are helping reach out to our community members that may be isolating themselves, because especially with our senior population, they're unable to come out of the house because they are at high risk. So we are making those phone calls. Sometimes participants or community members just want to chat with somebody. They just want to say hi to someone, and for someone to ask them, how are you doing today? And that's what these peer mentors are doing. And they are being trained in mental health. So sometimes it's just saying hi to somebody is just not enough. You need somebody to also be trained in mental health, right? So these individuals are trained, and they can assess to see during the conversation if they need a higher level of service and how we can help them. So that is still happening as well. And then, as I mentioned, the community navigators are at the Sheraton, and also the Project Room Key is also, that happened during COVID. And we are going to the motel every day, Monday through Friday, to be able to provide resources, to be able to provide linkages, especially because our homeless, calls from our homeless individuals or people experiencing homelessness for the first time, those calls have increased, and navigators have been helping them with that as well. And it's been a different ride for Tri-City. I don't want to say difficult, because it's not difficult. It's been what we do always, what we have always done, and we will continue to do. It's just different. The doors are still open. Please come in, and we are here to help, and we're here to listen to you. And with that, also with the social and racial unrest that happened in the community, we have formed our advisory councils, because people grieve in different ways in different communities, and people deal with mental health issues differently in different cultures. So Chris, can you please share my slide? And we have 3 advisory councils at the moment, and we're not next.
I'm so sorry. Dr. T, would you pass me back host so I can share Remy's screen?
Thank you. So we do have 3 advisory councils where one is the African American community, family and wellness community. We also have Adelante, which is our Latinx community. We're hearing from them. They're telling us, educating us on how to provide services to them. And then we also have the LGBTQ plus advisory council, again, advising us on how, what is it that works best in these times for those populations. And they give us advice on even how to provide clinical services, how to talk to individuals, how to connect with them. And moving on in the future, we are going to be also having, creating a Asian Pacific Islander Advisory Council. We're also going to be starting a TAY, Transitional Age Youth Advisory Council, as well as older adults advisory councils. So here are the dates and times. For the African American Wellness Advisory Council, we meet every 4th Thursday at 10:30 a.m. This time does not change, unless it's going to change this month only. We're meeting on the 3rd Thursday because Christmas lies, or Christmas Eve is on the 4th Thursday. So we, the council still wanted to meet, so we're meeting a week in advance. Adelante meets every 2nd Thursday of the month at 2:30. The contact person for that is Daisy. And LGBTQ Wellness Committee, also they meet every 3rd Tuesday of the month at 10 a.m. And I have the contact names and email addresses of these, but you don't have, if for some reason you are more comfortable just emailing me, I'm happy to connect you to the right council. And if you have ideas for what other sub-councils we can form, we are open to those ideas, and please reach out to us and we will create those. And Tri-City's open, and please come in. That's it.
Thank you, Remy. And please come in through our new doorways too, right? We're talking about our phone. We're talking about accessing us through Zoom. We have, we've always had our no wrong door policy, that whatever space you enter from, staff are trained to make sure you get to the right services. Now we just have more doors. So it's kind of cool. We have more doors. All right. So next up is Natalie Major Stewart. She is our Chief Compliance Officer. Natalie's been with us for almost 10 years. At Tri-City, and she has formerly our Best Practices Manager and has been our Chief Compliance Officer for the last 2 years.
Hello and good evening, everyone. Hope everyone can hear me okay. I'm just going to wait for a second. So you can go ahead and make me host, Chris, and we'll share my screen. Awesome.
You're good to go.
1 second. Okay, perfect. Thank you so much. All right. So I'm just going to quickly provide an overview of what we do in best practices. Again, my name is Natalie Major Stewart. I'm the Chief Compliance Officer and the overseer of the Best Practices Division. So the main goal of the Best Practices Division in a nutshell is to assure the quality of services in our system of care. We do this in a variety of ways. Some that I'll share with you is gathering and analyzing data and outcomes, auditing and evaluating our departments and programs, developing policies, procedures, and protocols. And we do all this in order to monitor and enhance the quality of our services in the system of care. And also we want to ensure that we stay in compliance with the federal, state, and local regulations. So most often the community doesn't see us because we work often in the background to ensure the quality of care. But here are some of the more direct ways that we interact with clients, participants, and stakeholders. So you may see us administering questionnaires, doing surveys to gather feedback. We'll hold special planning or improvement committees, one's going on right now, and then also responding to complaints and grievances through our issue resolution process. And that's basically if there's any time that a client, a participant, or stakeholder has a concern or dissatisfaction they want to express, they can contact our grievance hotline, and we will definitely work through resolving the issue. So I want to talk a little bit about how COVID-19 and modifications have impacted our branch of the organization. So one of the biggest impacts is that we needed to make some very quick adaptations. And so you've heard others speak about the adaptations that needed to be made to support the implementation of telehealth and remote work. So there's a lot that goes in on the background of those adaptations. So some of the things that we were instrumental in doing are researching and incorporating the new regulations and waivers related to the telehealth and service provision, configuring our electronic health record to support telehealth provision, establishing and revising protocols, workflow. There was lots of training that needed to happen. And then also very important is updating the auditing structures, because we wanted to make sure we continue to monitor to assure quality, especially through all of this transition. So really exciting positive things, because we love data and outcomes, that have come out of all of these adaptations is that we've been able to utilize the PDSA strategy to support the implementation of the various changes. So pretty much PDSA is Plan, Do, Study, Act, and it's a 4-cycle model that allows us to implement, evaluate, and then monitor and improve over time. So you start off with plan, you do, you study, and you act. Well, planning, things happen so fast, we had to jump in to do. And so we planned and did, and then now we're coming back and studying. So early on, we knew right away we're gonna have to come back and study the impact of all the changes on our system of care. So executive team and leadership team got together, and we definitely knew we wanted to gather feedback from a variety of sources. We administered surveys to clients, participants, and workforce members, and we wanted to identify how well are we operating, how well are we meeting the needs and providing services, what are the areas of improvement that others think that we need to implement. So we received lots of great feedback from clients, participants, and workforce members. So I'm going to share a few of the highlights. This is not all of the results, but here's some of them. So we found that a majority of client and participant respondents reported satisfactions with the interactions with Tri-City Health. So overall, people expressed satisfaction with the new method of receiving services and reported satisfaction with privacy during appointments, groups, and visits. Also, we found that the majority of client and participant respondents reported a preference to receive services at home using telehealth, and many people commented that felt very safe, and we're very thankful to Tri-City that we had this option to help them feel as safe as possible while still receiving services. Also, that the majority of client and participant respondents, over 70%, reported that they had the necessary equipment to do video and telephone services. And also that when it came to safety precautions upon returning, when we start integrating back into the standard workflow, that the 3 most important to respondents are wearing a mask, proper cleaning and sanitation, and physical distancing. So with these results and the other results that were received, now we're going to go and look at how we're going to plan for the next phases. So now that we've studied, that was part of the study, we're going to act on what we found and plan for improvement. To do this, we're going to launch a special, we are in the process of launching a very special quality improvement committee. We're going to address the key things that we found among workforce members, clients, and participants, and other data sources, make the necessary modification, and you guessed it, we're going to come back around again, plan, do, study, act. And so that allows us to do, as you can see here, continual improvement of the process. And this is very critical and crucial, especially at this time, because we want to make sure that we're providing the best services as possible. And so that is pretty much what I wanted to share with you. And now I'm going to pass it back to Tony and give you back controls, Chris. Thank you so much, everyone.
Okay. Thank you, Natalie. All right, next up tonight we have Jessica Wong, and Jessica is our interim chief information officer. She's actually been with Tri-City a year now, and she's been helping us to, and it was just serendipitous. Sometimes the way the universe has a way of taking care of things for you. We actually hired Jessica about a year ago this time to help us look at our IT systems and make sure that we were right on target for some changes that we anticipate in the next couple of years regarding data reporting to the state. And we were just really fortunate to have her on our team as the COVID pandemic hit, and we had to pivot pretty quickly. She and her team have been vital in our success these past 9 months. So Jessica Wong.
Hi, everyone. As Tony mentioned, I'm the interim chief information officer, and what that means is that I help to manage the technology department. And so as many of you can imagine, when COVID hit, that was a very busy time for our department. And so we had 3 things that we were focusing on at that time. The first was the ability for all of our staff to stay online and connected for clients. The second was to make sure all of our clients could connect as well to all of our staff. And the third was to make sure that everything was secure. As many of you know, security in the technology world, in the cyber world, is a little bit different, and so there was a lot that went into that. So, first step, we made sure all of our staff were properly equipped with the right technology. That was actually a challenge in and of itself, as the entire world seemed like they were all buying computers at the same time. So we were able to get everybody outfitted with the right computers, the right telephones, and the right software. The platforms such as Zoom and RingCentral that any of our clients are on today would be familiar with are ones that we've utilized for phone and for video services with clients. So we spent about a week. We got everything turned around within a week. Our staff worked extremely hard and very long hours to turn completely physical services, completely online. So I think I was really proud of our staff and how hard they worked in that process and how resourceful they were to make sure that everybody was able to stay online and working. And then second step was to make sure all of our clients could continue to stay connected. So as Angela had mentioned, we've been purchasing and connecting smartphones for any clients that need access. We've been helping students who have Chromebooks and computers from school connect to their clinicians. And we're actually working on some internet projects across the Pomona area to make sure that as many residents as possible in the Pomona area can connect and have access to affordable internet. And then lastly, we've been working really hard to make sure that all of your data is secure, that both our staff data as well as client data is completely secure. We've put in multiple extra layers of security controls and processes to ensure that there's that complete privacy of your data and to make sure that we are transmitting data in the most secure way possible. So we look forward to ways that we can continue to improve the ways that we're serving clients and that we're helping all of you to access our services. And so continue to give feedback to your clinicians, to anyone in the MHSA programs about how you're connecting technologically with our services. And we are constantly checking in, our department is constantly checking in to make sure that we're responding to needs. So, thanks.
Thanks, Jessica. All right, and our last speaker tonight is Keitha Torregano. Keitha is our HR manager. She's been with Tri-City just about 3 years now. So really wanted her to share a little bit about what her team's been up to, and then also share with you all the availability of work that we have at Tri-City, because not only are we helping others to find jobs, we're also looking for qualified applicants in many of our programs. Keitha.
Hi, everyone. My name's Keitha Torregano. I'm the HR manager here for Tri-City Mental Health. My team, a staff of 3, there's only 3 of us, it has been responsible for making sure that we transition all of our HR services to virtual or online, and then as well as making sure that our employees as a whole who are providing services out there to our community are safe while they do so during this pandemic. Majority of my team has been providing services via phone and email for a long time now. All of our applications have been transitioned online way before the pandemic, but we wanted to make sure that we can still engage with our employees and our candidates, applicants on a regular basis while they're not able to come in or contact us via phone as much as what's normal. So what we've been doing is my team has been transitioning our new hire orientation online, which has been difficult for us because that's when we get to see our faces of our new employees who come in. We get to meet them, learn about their background and their history, and that's always best to do in person, but we've been able to transition that to video conferencing as well as a variety of other services like benefit administration with employees that come in and have questions about benefits and leave administration as well. And as you've heard, all of the great programs that our agency offers, I wanted to go ahead and promote the variety of vacancies that we have available. Chris, if you can give me sharing capability so I can just walk the participants through our website so they can know how to find our opportunities.
Okay, you are the host now. You can share.
Okay, thank you. So this is our Tri-City web page, and in the corner, right in the corner, you will find a link for our jobs. If you click on that link, it will take you to our CalOps page, which powers our employment opportunities. This is where you can find all of our available openings as well as apply for our jobs. This has been available before COVID, and it will be available after. It's a seamless process for you to apply. Very easy. You don't have to come in. You don't have to call us. Everything you need is pretty much right here. The most important button, I would say right now, is this subscribe button right here on the right. If you want to know the latest of what is available for our agency, you'll click on that subscribe button, put in your email address, and every time we post a job, you'll get an email. So you have the latest and greatest information. If you want to contact my team, we have our email address here, hr-team@tricitymhs.org. That is where you find us if you have questions about any of our positions or what they do or what the qualifications are. And then if you scroll down here to job openings, this is where you'll find a list of all of our available vacancies. As you can see, we have a variety. If you are a licensed mental health professional, we have clinical therapist positions open. If you're not licensed, we have mental health specialists and psychiatric technician. And if you're already a pretty seasoned mental health professional, you're looking for the next step, that promotional opportunity, we have a variety of clinical supervisor positions available, one of them at the Wellness Center that Remy spoke about earlier. This actually is a great opportunity if you're looking to oversee internships and grooming that next generation of mental health professionals. And we also have executive level positions. So as Jessica mentioned, she's our interim CIO. We are currently recruiting for a chief information officer, which will oversee our information technology team. So you can continue to help us make sure we have the latest and greatest technology so we can continue to bring forward these Facebook Live information nights. And then we also have our Chief Clinical Officer position that's available. Angela, our current Chief Clinical Officer, is leaving us soon. So we are currently accepting applications for that position as well. Again, all of these positions are available online. You just click on the link of the position that you'd like to apply for, and it will take you to the apply page where you can learn more about hourly rates, where it's located, and then you can click that apply for job button. So any questions that you may have, you can reach out to my team. We look forward to your application and hope to hear from you soon.
Wonderful. Thank you, Keitha. And yes, it is. That is a very difficult conversation and a touchy spot for all of us. But, you know, COVID has people really looking at their careers and their lives and their next step. And Angela Grisson, our Chief Clinical Officer, is heading into retirement in the next few months. And so we've posted for that position. And so if you have anyone who might be interested, please send them our way in any of those positions. That wraps up our speaking portion for the night. And, you know, when I thank you for sharing the website, Keitha, and there was a huge glaring thing right on the website that I can't believe I missed when I started. But as I reflected for a minute, why, because I thought about it a few minutes ago, Tri-City Mental Health is 60 years old this fiscal year. We just turned 60 as of June 22nd. 2020, and this fiscal year is our 60th year of operation. I think I've kind of put that on the back burner because we had such a great slate of events and community parties that we had 3 big events, one for our local electeds and organizations, one for the community, and one for the staff that we were planning during this year, which we're just going to put on hold and we're just going to delay. So I think that's something in my family we've all decided, like we're just gonna stay whatever age we are, and even after COVID next year we just get to be that year. So Tri-City is gonna celebrate our 60th year when we can all be back together. Oh, I see that someone likes that idea too. So it's our 60th year, and we're just really, really glad to still be here with you all in the community, providing public mental health services, outpatient services to Pomona, Claremont, and Laverne. The mental health field has seen a lot of changes in 60 years, and COVID has now taken us to a whole new level of service delivery, and we're really excited about that. While it's been challenging in many ways, it's also been really exciting to see what is possible when for years, as I think Angela and Remy both mentioned, we never thought we could do the work this way, and Diana did too. And actually, having been forced to, we're like, wow, this really works. It works for our communities, and it works for our staff, right? Because taking care of staff in this difficult time and allowing them the flexibility to be in and out of the office during this time has been really helpful as well. So thanks to all my team for presenting tonight. And now I don't see any questions in the chat right now, but also I don't know, Chris, if we have anything on Facebook, if anyone has any questions.
We don't have any questions, but I just wanted to say, if you do have a question, you are welcome to unmute yourself. If you want to remain anonymous, you can just put your question in the chat so that we don't necessarily have to hear your voice or see your face. So whatever you feel more comfortable with. If you are watching on Facebook and have a question there, I am monitoring the comments, so I will communicate those to the team on Zoom.
No? All right.
We do have one question. I was curious as to how many people have been using the 24/7 phone number since COVID began.
Actually, we get a report weekly from our manager of the intensive crisis support and outreach team, and it varies, right? So prior to COVID, the line was not used that much. It was maybe used once a week, and now I think last week we saw 12 calls in 1 week, and prior to that it was about 4 to 5 calls a week. Some weeks it's 10 to 12. So I think it just depends on how people are doing. We anticipate there will be more use as the surge continues and people are feeling a little more nervous about what's happening. So thank you. All of the persons that answered the call are licensed therapists, and so we just encourage you to share that number. I put it in the chat earlier, 866-623-9500. All right, so thank you. Thank you. We have a person who spoke on chat and said no question, but a huge thank you to all of you. Your housing team helped my brother find a home last year, and he is grateful. And actually, our housing manager is on the call tonight, so I see you there. So go team. Thank you so much for sharing that comment with us. I think that's it for the night. We're going to get everybody out of here on time. Everybody, please stay safe and well. And again, remember, we do have community PPE and disinfectant. For those who need it, you can reach out to our navigators. We also have donation boxes. And that 24/7 number and our peer mentor team for those who may not need a higher level of mental health support, but just want someone to talk to and share their day, their concerns with. So Tri-City welcomes everyone, and thanks everyone for joining us tonight.